Welcome to Energize and Revitalize with Dr. Amy. I'm Dr. Amy Coopersmith, a doctorate prepared nurse practitioner, and this show is about empowering you to live a radiant, healthy, and balanced life. I'm very excited to introduce today's guest, Candy Peterson. Candy is a certified personal trainer and master Primal Health Coach. She has additional certifications in corrective exercise and performance enhancement. She serves as the health coach for both Amethyst Wellness and Florida Coast Weight Loss Center. She is also the co-owner of Fit Body Boot Camp in Port Orange, where she helps busy people build strength, lose fat, and feel confident in their own skin. When she's not coaching, you'll find Candy spending time with her husband and 3 boys. Welcome.
Thanks for having me, Amy.
So Candy and I met years ago. We worked out together. We had the same trainer, and it was at a boot camp.
It was.
Yes. And over the years, that relationship's evolved. We've done many exercise things together, but then our paths crossed professionally when you got into health coaching, and you and your husband, Dr. Darren Peterson, helped me develop our medical weight loss program. And I think it's been really better for it.
Yep. I've been not just us working together exercising wise, but when we used to run together, I was always chasing Amy.
So for those of you out there who run, you know what we're talking about. There's always that person in front of you that you just have to catch, which we have a very friendly group, and we really like to motivate each other and encourage each other. So what inspired you to become a health coach?
Well, when we moved, we did a stint in Texas for about 8 years, and my husband joined 2 other bariatric surgeons in their practice, and I came on as their personal trainer and quickly realized that there was so much more to weight loss than just exercise. These people really needed help with, nutrition and sleep management and stress management. And one of the physicians there was a big primal health. And he kind of inspired me to kind of go the health coaching route. And I quickly found out that it was a great combination with personal training to really ramp up how I was able to help our patients.
Awesome. So you mentioned Primal Health. What is Primal Health?
Primal Health is a platform that basically takes us back to the way our bodies were designed to function before there was a McDonald's on every corner and we had cell phones and fancy gadgets, and it takes us back to basics. No processed foods, functional movements, those types of things. Sleeping with the sunrise and sunset, and lots of things that we don't, as a society, really do anymore.
Yeah, that's hard to do. And I think people can kind of get overwhelmed when they think about, in this example, we're talking about weight loss, but there are so many different aspects to successful weight loss.
Yep.
So the primal movement focuses on pillars of health management. Or of weight loss, I'm sorry. So what are some of those pillars?
Well, there's really 4 basic ones that we really zone in on, and that's physical activity, movement, functional movement. That's something we're going to do until we are no longer here. So we functional movements are big. Nutrition, taking it back to basics, clean eating, sleep management. It's a huge one. And stress management. We have so many stressors.
Yes.
So those are really the big 4 pillars that we focus on.
Okay, well, let's start off with functional movement. What do you mean by that term?
So lots of the things that we have to do every day to function: squat, lunges, pushes, pulls, those type of movements. Getting out and having playful movement, stuff that doesn't really involve exercise, is important as well. So just making sure that as our bodies age, we are able to move and function well.
Yes. And I had read something that even very active people that, let's say, are marathon training, if they train and then spend the rest of the day on the couch, that's as bad as if they weren't training at all.
100%. Yeah.
So just that movement, it doesn't have to be something you don't like.
Right. I actually encourage it to be something that you enjoy, because you'll stay consistent with the things that you enjoy. I talk to people all the time. They're like, yeah, I did 30 minutes on the treadmill today. Like, did you like it? No. Then why are you doing that? You're eventually going to stop doing that.
Right.
So you got to find those things. And I think those things change as we age, you know.
Absolutely.
I'm not into CrossFit anymore, and there's a reason, because I've gotten a little bit older and my body just doesn't do well with those types of things. So the things that I enjoy have shifted and changed, and I think we need to be able to do that as well.
Oh yeah, absolutely. Our bodies change.
Mm-hmm.
So even the amount I used to run, that's not right for me anymore.
Yeah.
So I have to do things a little differently.
Yep.
So when it comes to weight loss, is there a specific type of exercise you find that's more effective?
It's a great question. At Fit Body, we focus on HIIT training. We do a lot of, strength functional movements, but we also have days that we call Metcons, and they're metabolic conditioning days, where we spend a lot of time putting you in a good little heart rate spike, followed by some active recoveries.
Mm-hmm.
And we find that our clients not only do well from a cardiovascular standpoint, but also that's where they lose a little bit of that extra fat while enjoying the workout as well.
Yep. So HIIT is high intensity interval training.
Mm-hmm.
So just as you described, it involves getting your heart rate up a little bit,
Mm-hmm.
but not to the point where you're collapsing.
Right. No, not for long periods of time. And actually my weight loss patients as well, that's kind of what I recommend to them. You know, if you're on the treadmill and you're doing a 15-minute walk
Mm-hmm.
on the treadmill, give yourself 30 seconds of a higher incline or 30 seconds of a higher speed, so you really get that good heart rate spike, and then go back to normal, get that full recovery, throw a couple more of those in your little 15-minute, and it really takes that 15 minutes kind of to the next level.
Yep. And that's really good for endorphins too,
Mm-hmm.
to make us feel better.
Yep.
So let's talk about nutrition.
Okay.
What are some things that you encourage your clients to do?
One of the biggest things I encourage my clients to do is take things one step at a time. Making big, huge sweeps and changes all at once usually ends up, we feel defeated. We can't manage everything at once. So pick the one thing that is what you see as your biggest struggle bus, or maybe something that really is part of your goal that you're trying to accomplish. The biggest things that we preach all the time is decreasing sugar intake, staying away from those processed foods, avoiding offensive oils, the inflammatory oils that cause us to have, I think they're probably becoming one of the more dangerous things that we consume on a regular basis. And just eating lots of natural whole foods that our bodies were designed to consume.
Yeah, I think keeping it simple like that, and if it looks like an apple, chances are it's good.
Yeah.
But if it's in a little package and you have to read the ingredients and, there's some apple in there, well, that might not be our best choice.
Yeah. I usually say if it comes in a package, bag, or box, make sure you're reading your labels so you know what's in it.
Yeah, and I know you mentioned the inflammatory oils. Inflammation is being discovered as a huge cause of obesity.
Yep. It's huge. It's one of those hidden things that I think all you have to do is go in the grocery store and look at, when you're reading your labels, the first couple of things listed on that label are what most of what's in that product. And it's amazing how many go straight to canola oil, vegetable oils, just the bad ones. If it can sit on a shelf for,
and it
6
doesn't go
months,
bad.
do you really want to put that in your body?
Right. Oh, that's amazing.
Yeah.
Do you encourage people to go low carb, keto, or does it just depend on where they're at?
That's a great question. I don't think there's a wrong answer. I don't think there's necessarily anything wrong with keto. I don't think there's necessarily anything wrong with paleo. It's that we try to always fit ourselves into one box and thinks that that's the key, that is what's going to do it. And our bodies are constantly changing and evolving, especially as we age. So we have to be, the biggest thing I tell my clients is listen to and get in tune with your body, because it's going to talk to you. It's going to tell you what it needs. And if you're in tune, you're going to know when to make that pivot. You're going to know when to make that change. Naturally, Primal is pretty much low carb, low processed carbs. You can pretty much eat all the carbs that come from whole foods that you want, and it's going to be fine. It's staying away from those processed foods. So, do I don't like to put people in a box, I guess is that. It's not always going to work for every person, and that's kind of where the health coach comes in
Right.
to, understanding that person's likes, dislikes, non-negotiables, family dynamics. Not every one of those nutritional guidance things is going to work for every person. So it's finding what works best for you and knowing when you need to shift and pivot to other things.
I think that's so important. When people come to my clinic for weight loss, they always want to know, what should I eat? And so we start with the basics, but I always encourage them to visit with you because, it is that individual component. And some people don't have time to cook, or they're cooking for family.
Right.
And that's a huge one, because the
Right.
family won't eat what they need to eat.
Mhm.
So, just to come up with strategies on how to make them more successful.
How to manage that for that individual.
Right.
Yeah. I get all the time people that want me to do meal plans, which I can't do, number one. And number two, even if I could, you don't want to come to my house and do a meal plan for my kids. But if I can help you understand how your body responds to the foods that you eat, from a hormonal standpoint, from a sustainable weight loss standpoint, then you can make those healthy choices that fit best for your family. And it makes it a lot easier. If we give you a meal plan, what are you going to do? Eat it for 3 months and then what? I mean, we haven't really taught you anything about your body and how your body responds to it. That's where it becomes super powerful. And that's where, when you figure that out and you start to understand that weight loss becomes sustainable.
What is your opinion on intermittent fasting?
That's another great question. I think it fits great for certain people at certain times. Again, it's one of those things that I think a lot of people try it before their body is in a place where it's ready for it. You have to be metabolically flexible to be able to get the full benefits, I think, of intermittent fasting. And I think people also get in a rut with intermittent fasting. They do the same thing all the time, and our bodies get kind of used to that. So you have to change it up. I fast, but it's not the same every day. It depends on, what my workout schedule is going to be like that day. Intermittent fasting works sometimes great for people that travel a lot. So it's finding out when and where it works best for you. But I do not have a problem. I do it myself. It just doesn't look the same all the time.
Yeah, a lot of the longevity experts really like intermittent fasting. And I will tell you, I've tried it for myself and I get hangry.
Oh, yeah.
I do not do well, but my exercise pattern is I work out pretty hard in the morning. And I find through trial and error, my body really likes that first meal within an hour or so of working out. So for me, the intermittent fasting isn't the right choice most of the time.
Right. Yeah. And that first meal is super, super important. So no matter when you have it,
Right.
And that's what I tell people. It works for some, and for some people, not so much.
Oh, well, thank you for sharing that.
Yeah.
Well, I'm going to have you hold that thought. We're going to pause for a break from our sponsor. You're listening to Energize and Revitalize with Dr. Amy. Don't go anywhere. We'll be right back. Welcome back to Energize and Revitalize with Dr. Amy. I'm Dr. Amy Coopersmith, and my guest today is Candy Peterson, health coach and co-owner of Fit Body Boot Camp. Before the break, we were talking about the pillars of weight management. We talked about nutrition and healthy movement. So stress is also a big component of weight management. What are some things that you encounter or recommend for stress management?
Well, let's just recognize stress for what it is. I mean, from the minute that alarm goes off in the morning, we have these constant stressors. You check your email, you're stressed out. If you have teenage kids like I do, you're stressed out. We have stressors. Our body is made to handle short bouts of stress. The problem is now we live in a society where the stress is coming at us constantly. Right. And that can be really hard to manage. So one of the biggest things I recommend always to my clients is let's manage the manageable. So if you're in a stressful situation, which sometimes we are, things that we cannot control, a death in the family, an illness, job stresses, let's make sure that our nutrition is on point. Let's make sure that we're sleeping as much as we can. Let's make sure that we're being active and moving. Shift that focus to the things that you can control, while there may be some elements of those 4 pillars that are out of control. And always try to find something, 10 to 15 minutes a day that just relaxes you, takes your mind off that stress. For some people, it's meditation, praying, reading, exercise is one for me. Just being able to, I remember when my kids were little, just being able to put my headphones on and going for a run was, while it was a stressor to my body, it was a positive stressor to my body. And it was also a plus when it came to my overall stress levels. So just finding that thing that you can, unplugging from electronics.
Right.
I know it's hard. I feel like I'm constantly hooked to my phone, but being very diligent about setting aside those times where you're unplugged from that TV, unplugged from social media. It's another big stressor. Just, taking back control of the things that we can.
Yep. And I shared with you off air that I was just in a place recently where I didn't have internet.
Mm-hmm.
And it's nice because you can't, sorry, I can't check my email. Yes. That will have to wait until I'm back.
Mm-hmm.
And it's hard to do, but it's really liberating.
Yep, for sure.
So what are some things you recommend for healthy sleep?
Oh, that's a really good one. Mm-hmm. Unplugging those electronic devices is one. A lot of people, I talk to a lot of clients that are like, I can't go to sleep. I have to play a game on my phone. Or what we're not understanding is those bright lights, those things are, hormonally keeping our bodies from doing what they do to help us go to sleep. Nutrition is another one. Having good nutrition helps with sleep. Being physically active helps you sleep. Maintaining a room where sleep is possible. I grew up in a home where there was a TV on 24/7. It didn't matter. Going into a quiet room with a good temperature that's for sleeping. All of those are types of things that there's lots and lots and lots of things. But I think one of the things I see the biggest problem is just that putting down those electronic devices, turning off that TV at least an hour, maybe 2 hours before you go to bed to allow that body to relax. Go take a nice bath before bedtime. Any of those things is going to get your body in a space where you can go to sleep.
Yeah, they've done a lot of research on the lights on your phone and how they do kind of mess with the melatonin production.
Mm-hmm.
Now they do have filters, or I think glasses that will allow you to look without that detrimental effect. Mm-hmm. But if you're looking at social media and things that are kind of inflammatory or excitatory, that's not really a good method to go to sleep.
Exactly. Yeah.
So what are some common things you encounter during the health coaching process, or barriers?
Barriers. Let's see. What do I get? A lot. People that really don't dig into their why. I can't ask very often, what are your goals? What's your why? And the number one answer I get is, I want to be healthy.
Good.
Okay. Well, who doesn't want to be healthy? Mm-hmm. But what does that look like for you as an individual? So I usually ask them, hey, let's fast forward to a year. You can see the healthiest version of you. What does that look like? And then they start to unravel some of those layers. Well, I want my blood pressure. I don't want to be off blood pressure medicines, or I want to, sleep through the night, or they start to unravel goals that we can now work on and get to the gist of their why. I think the other thing that is a big barrier is the scale weight. A lot of people have a scale weight in mind, and they forget all those non-scale victories that really, really matter.
So what is a non-scale victory?
Having your blood pressure, being off blood pressure medicine.
That's a huge one.
Let's see, in the weight loss clinic, we have all, going to the theme park and riding in a roller coaster, or fitting in an airplane without a seatbelt extender. Yes. Getting on the floor and playing with my grandkids, or being active again, being able to keep up with my kids in the first place. There's all kinds of things that have absolutely nothing to do. I mean, yes, of course, as you lose the weight, those things become easier, but people get stuck on that scale weight because they
Right.
don't, if you don't know your body composition and you don't understand why you may be losing weight or not losing weight on the
Mm-hmm.
scale, it can really throw a lot of people off.
Yeah, I've had people come into clinic and say, I didn't lose any weight or I lost a pound or, and they expected more. And then we get on the body composition scale and I say, oh, we're down 3 pounds of fat and up
Mhm.
2 pounds of muscle. That
Yes.
is a huge victory.
Yes.
And so if we're just measuring on the regular scale, we might not see that.
Yes. Yeah. We tell people to throw their scale out with the bathwater.
Very nice. So you use the body composition.
Yes.
And what do we learn from that?
Uh, Knowing your body composition, understanding, how much of your body is muscle, how much of your body is fat, where those areas are that you need to focus. I think it's huge, especially kind of in the world of all these weight loss meds.
Right.
Understanding your body composition, I think is huge. And when you're on any weight loss journey, knowing where that weight loss is coming from is huge.
Yeah. A particular struggle that my clients have is keeping that muscle mass while they're trying to lose weight
Mm-hmm.
in pounds. So what are some things you recommend for people to keep their muscle?
Doing regular resistance training, for sure. Protein intake,
Yep.
making sure you're consuming enough protein, the timing of your protein. I have a lot of ladies that come into the gym and they do a really strong, workout. They lift heavy and then they don't eat for another 6 hours. So backing up nutritionally what you do in the gym is important. Those are definitely always, consistent resistance training and nutrition to
Yep.
back that up.
I think sometimes active people are surprised that when they work out, if they don't eat enough, their body's going to store fat because it thinks that they're in a danger situation.
Yep. Yep. And to be honest, I think that is what we deal with more in the weight loss clinic than we do. It's the people that aren't eating. They're not consuming enough and their
Right.
body hormonally is responding
Yep.
negatively to that. I mean, it can be on both sides of that. You're consuming too much, but more often than not, we're seeing the people that are eating like birds and killing themselves in the gym, and hormonally their body is not responding well to that.
And that doesn't feel good. That's when we get
Mm-mm.
tired and we get sick. And so we need to eat good stuff.
Yes. Yes. Good stuff
Good
for
stuff.
sure.
So speaking of muscle, tell me about Fit Body Boot Camp.
Fit Body Boot Camp is actually when we were in Texas and we're moving back to Florida, and a girlfriend of mine, very dear friend of mine, had just opened a Fit Body Boot Camp in Texas right before we moved. And just kind of watching her open and knowing that we were going to be opening the weight loss clinic here in Florida, we just thought it was going to be a good mesh. We had partners that started with us in Port Orange, and unfortunately, from a business standpoint, we just weren't on the same page. So my husband and I ended up taking over at the beginning of this year. Which is why it's in Port Orange and we're here in Flagler. But it's great because I have met some of the most amazing people that I do not think that I would have crossed paths with had we not opened the gym there. But it's 30-minute HIIT style sessions. It's the other thing that I really love the most about it is it's 30 minutes. We get you in, we get you out. I'm a busy mom of 3 boys. I cannot be in a gym for 2 hours a day or even an hour a day. So we have lots of session times. We focus a lot on that body composition, making sure that what they're doing in the gym is helping them reach those goals that they come in for. We just actually started a Fit Body Forever, which is our 55 and older. It's a little bit longer. It's about 40 minutes, but we take a lot of the impact out and we focus a lot more. I won't say a lot more. We do the same functional movements that we do in boot camp, but we do a little bit more focus on strength as opposed to metabolic conditioning with those, because our, 55 and older, once we hit 40, we're naturally losing lean
Yes.
muscle. We don't have to do anything to make that happen. So making sure that we are lifting something heavy
Yes.
occasionally is super important.
Yes. And I feel like I say this every single day, but as we get older, maintaining our muscle mass is crucial
It is.
to healthy aging.
It is.
Whether we care about how we look
Mhm.
or not.
Mhm.
None of us want to be sick or immobile. We
Mhm.
have to be able to lift things to function and take care of ourselves.
Yep.
So for our listeners, if someone's out there listening and they want to start on their weight loss journey, what's one thing you would say to them to get started?
I would say really think about your why. Really do that whole fast forward thing. Fast forward a year, and you're the healthiest version of you. What do you see? And write down every single one of those things, because as you start to check them off your list, it also gives you direction. Where do you need to? It can be overwhelming when you want to start on a weight loss journey.
Right.
So it really helps you focus in on what is the most important thing to me, and what are the things that I need to be focusing on first. Doesn't have to be all of it at the same time, but knowing your why is really going to help give you that direction.
And I think that helps keep you on track too, because it's not easy.
Nope.
Any change in whether it's learning a new skill or losing weight, it's not easy. And so reminding yourself of why you're doing it.
Yep. Yeah. When you're not seeing anything, or you're not seeing the changes you think you need to see in the time frame that you're expecting them, going back to that why is what keeps you connected and focused. Yeah.
So how can people find out more about seeing you as a health coach? We'll start there. So if they I want some health coaching, how do they find you?
Florida Coast Weight Loss Center, for sure, or Amethyst
Or
Wellness.
Amethyst.
Yes. And usually what it looks like is I like to send your clients, especially, an intake form. It's kind of the 30,000 foot view into them. I'm going to ask a lot of questions about their, daily activities, their nutrition, their likes, dislikes, their goals. And our first session is really just kind of get to know each other. I want to hear what your goals are, what your struggles are. And then from there, we start to dig in. Once I know what your goals are, then we know.
Yeah, make a plan.
Yeah. Because while I have some nutrition, knowledge and physical activity knowledge and all of those things, my client's the only expert on them. They're the only ones that know, their likes, their dislikes, their family dynamics. So it's a collaborative effort, the health coaching one. We work together.
It's a partnership.
To help them, either achieve the goals that they're trying to achieve, or get over a barrier that they've got to achieving that goal.
Nice. And then Fit Body Bootcamp, Port Orange is not that far away.
It's really not. I make the drive every day. It's 30 minutes. It's not that bad. And when you're only working out 30 minutes,
And there's some good shopping down there.
There is,
So you can go work out and then have a little non-sweet treat.
Yeah, there you go.
All right. Well, I want to thank you again for joining me today.
Absolutely. Thank you for having me.
And thanks to our listeners for tuning in to Energize and Revitalize with Dr. Amy. If there are topics you would like to hear about, please send an email to radiantpodcast2025@gmail.com. Check out past episodes on Amethyst Wellness YouTube, and please like and subscribe. I'll be back next Saturday morning at 7:30 with more expert insights and practical strategies to help you live your healthiest, most energized life. Until then, stay healthy, and here's to your best life.